year's spending is the best we can do, I think. But we're a long way from coming to the conclusion of spending, and that's not what anybody believes is likely to happen. We don't have a good number to work with, but we will intentions to at least match what the House did on health research spending. But let's hear about the things you think we ought to do in addition to that. And then on the non-research front on cancer, Senator Brown and I, a few years ago, introduced a bill where, like, every woman who has breast cancer surgery has to be told all of her options. That's the case now everywhere. 5 years ago, it wasn't the case. Minority women generally were not told all of the things they could be thinking about. Doing some legislation this time where if you have the likelihood of breast cancer, you immediately qualify to go to with the government, various government plans to the next phase of finding out what the problem is, rather than, well, we need to wait a while longer and do a few more tests and let's get this 6 months. It's not acceptable. But let me listen.
Well, again, we appreciate all your support. So our ask, as Tim had said, is for 2.5 billion, and that what we've been getting the last few years, and that's what our ask is. With the 2 billion that's already on the House side, we can ask if we can have the 2.5 billion like we've been getting the last few years. So that would make it at least 41.6 billion that will be funding cancer research dollars. So we would appreciate that support if we can have that asked.
I can't make it short. First of all, I want to thank you for everything you've done the last few years, especially you've become one of my heroes. I'm a geek. I watch a lot of political things on TV. I listen to you when you call in on 550 radio in the morning with McGraw-Millhaven, so you know I pay attention. This gentleman was our hero in the last budget hearing. We had an increase of over an extra $1 billion. We just came out of one of the worst recessions in a lot of our lifetimes, and it makes a big difference when you see the money coming in. And now that we're in a stable economy, and hopefully it continues, now we're here to ask you for more money. And what we're here today for is that increase to the National Cancer Institute. And I know you just said, that we're going to try to stay, but there's a lagging behind in the National Institute for Cancer of about 1.1 billion from 2003, from the inflation, that's kind of changed between then and now. Okay, so now we have a really robust budget, and especially, after last year with the increase. So we are looking for, the increase to be like 378 million, which would be about, what is it, $78 million more?
We have more information.
Okay,
Okay.
all right. But anyway, we're asking you to help us, fund at least the 6.5 billion, which would be a $378 million increase to this year's, fiscal year budget. And again, thank you. And
He also just, not that that's any that can't happen, but also under some of the other targeted things like the brain initiative. A lot of this money actually winds up as part of cancer research as well. It's not in the traditional cancer category, but a significant percentage of that is focused on.
The bigger the pot, the more we'll go around to.
Good morning, and thank you for coming. We do appreciate it, and we appreciate your leadership over the many years of taking care of putting cancer at the top of your list. Shortly, what we're wanting to ask for, and the more I read about this, the more it makes so much sense, and it's increase funding for cancer registry to the CDC. And if you sit and think about it just for a very short period of time, you can understand that the information gathered from cancer patients, what kind of cancer they had, their background, their health, their location, and how they reacted to the treatment that they've gotten. Putting that in a database is an incredible amount of information for a doctor or a team to base their treatment on their patient. Right now there's a 24-month lag in the data being processed. They,
At CDC.
yes. And, you know, that's unacceptable. It is to me. Gonna need the equipment, gonna need the people to do this. And it's not only good for our cancer, it's not only good for our cancer patients for their treatment, but this information can be used for many other things where we can share. And I've said this before, I think it's important that we look at many big pictures on this. While we're in negotiations with other countries, what can be a better thing to say than let us share our cancer research and treatments with you for your people? To me, that says an awful lot. It really does. So we're again asking for a $19 million increase for the CDC. And it'll let them collect the data and get it in real time and make a cloud data service on this where it's easily reached by other doctors and cancer treatment teams.
Brad, would you share your story, family story, and Ryan's story?
Yeah, Senator Bowen, my daughter's a great example of what you talked about earlier. She's 9 years old now. 3.5 years ago, she was diagnosed with stage 4 high-risk neuroblastoma. She was given 20% chance to live, but thanks to 2 immunotherapy clinical trials that are currently ongoing, it saved her life. And 5, 6, 7 years ago, there wouldn't have been any chance for her. But because of the funding that you provided, she has a chance of life, and she's thriving now because of that. And so it really is amazing. I guess my ask, though, is, she got diagnosed when she started the process. There was about 20 other kids that started the process with her at Sloan Kettering Hospital in New York. Only 4 or 5 are still alive today. And so there's still a lot of work to be done, but the money that has been invested so far is paying dividends. We're proof of that. And if we can continue to invest, obviously we're on the brink of some really great things. So thank you very much.
For Health, Mental Health, and Social Services, so all the money he's sending down goes to my committee to make it out. And people line up at my door, like Mark is there every year to ask for that money. This is an extremely close issue for me. I'm a cancer survivor from 2017. One of the things I'll remember probably forever is I was sitting in a committee hearing and my phone rings and I step out and it's Senator Blunt, tell him to tell me it's going to be okay. So he has been involved and very personally involved and close with this issue, so I know it's when it becomes personal, it's easier to defend and ask for the money, and your odds of receiving it's much greater. I'm not going to cut any money on the state level coming your way. We'll try and find as much as we can. I'm thrilled to death that we were able to help with this precision medical treatment center coming up in Columbia. That's going to revolutionize medicine. And I think it's great that Missouri's going to be at the center of it. It also hit home 2 weeks ago. My grandson was diagnosed with leukemia. So the better the research that we have, the better his chances is going to be. So it's
David, how was he?
3. This community is amazing. When you go to Relay for Life and you see the number of people that show up, the amount of money that's raised, It was a new experiment this year down combining 3 counties at Big Sur. But Darren was extremely gracious in opening up. I think it's going to be a good deal as it catches on. And get people involved, because the more people know, the easier this becomes. With the tornado, obviously my mother-in-law's house was right in the center of some of the hardest hit in town, so I've been cleaning up yards, hers to start with, and then up and down the street. It's, again, amazing how the community come together. The amount of people that were organized, the groups that come in to clean up trees, it's just unreal how small towns, small communities, we're a family. And that's why I like living here and representing this area.
On your committee too, on behavioral health, we're doing some
Oh,
significant stuff
amazing.
in our state. Some legislation, Senator Stabenow and Democrat from Michigan and I had, and we're one of the 8 states that we're now into approaching the 3rd year of treating behavioral health like all other health. And qualified locations, and there are about 200 different access points around the state where you can go with your behavioral health problem, and however any other health problem would have been handled. And frankly, I think what we're going to find out, David, is if you do that, you actually probably save money. You almost certainly don't cost any extra money because of your dealing with people's behavioral health issues like you should. Your other health issues are so much more easily managed. And we'll see. That's the purpose of having this big 8-state study and compiling factors on about 25 other factor points to determine what happens if you show up for your appointments, you take your medicine, and you're eating better and sleeping better and feeling better about yourself.
Well, and you were also a champion for the mental health liaisons and getting the right treatment to the right place. So when law enforcement or emergency rooms has a patient that needs mental health treatment more than they need incarceration, we have someone to go out and take care of that. We expanded the community health workers this year. We've expanded home visiting for Children's Division, trying to be proactive and solve problems before they actually occur.
The subject matter we're talking about here and growing what we investigate, everything of that nature, has the potential to touch every person in this room and has our family at one time or the other. So it's very important that we do our very best. In my family, a little over 5 years ago, my sister-in-law was diagnosed with a rare breast type cancer. She went to some different hospitals in the southern part of the United States, and she ended up in Houston, Texas, in the Cancer Society hospital there. They told her that the type of cancer she had, the survival rate was 1 in 10, okay? But however, they had discovered a new way of treatment. And if she would volunteer to go through this, okay, in the last few months, she was declared, and it was 5 years, a little over 5 years ago. In the last few months, she was declared cancer-free. So the procedure and the method that they took and it was discovered will probably be passed on to others to treat the same thing. And I think things of that nature are very positive. Okay, and all the effort that we need to do that because it can affect everyone in this room. The other thing about I think the city of Eldon, we look at a lot of different ways. Yes, we had some severe total destruction to minor problems in almost a lot of the homes here. But in the other way to take a look at this, all this stuff could be rebuilt and redone. The number of people that was inside these homes and things that got hit, okay, that survived, you know, without injuries or fatality, and to have one injury in this community, for that to go through, the Lord blessed us with that, and we should remember that. Okay. Now, as far as recovery, as David mentioned, I don't think I've ever seen so many volunteers come together and work to take care of the situation. And it's a step-by-step progress that we're going through. I know that SEMA's been in, took a look at the damage. I know FEMA and Randy, you're back here somewhere, you and Ray can elaborate on them. They've been in here, FEMA was in last week and looked at individuals, is that correct?
That's correct.
Okay. This coming week, they're coming back in and they're gonna look at the public portion of it
Yeah.
and things of that nature. Yes, do we need assistance in those areas to help to get everything back? We do. And we ask the support that we can get from your position, Senator, on the FEMA end of it to help us recover from this. I know that anytime that you hear about a man and his wife and a 3-month-old baby, and the storm begins to hit, and the only place they got in their home to go in is get in the bathtub. And when the storm went through, the only thing that was left was the bathroom and them in it. And they were up and they were walking down the street over, and a man picked him up, and just I heard this on the news, it's an interview. And he sat there and he asked him, what are you doing out here in this weather, this? He said, our house is away. Now, if you're laying in a bathtub with your family, and that comes through, and everything's gone, but you and your family, the only thing I can say, we've been blessed, and we must keep that in perspective. And we appreciate what help we can receive from your office, Senator, and help us getting the help we need.